All right, well, let's go ahead and get started. It's 5:03. So we'll call the meeting to order. This is the Wednesday, July 7th meeting of the Committee on Health and Human Services. I'm City Councilor Jesse Letterman, Chairman of the committee. We're joined by our colleague, Councilor Sean Kern, who's a member of the committee, establishing quorum. And we also have Ward 1 Councilor Gumersindo Gomez with us. Councilor Gomez, good to see you. And then we have Nellie Maldonado from Tapestry Health and from the Board of Public Health. And we also have Justin Shellman from the Department of Health and Human Services with us. This is being recorded for our Focus Springfield YouTube page, so will be available for folks to view back in compliance with the current statutes of the open meeting law. So the purpose of today's meeting is just to get an update on the status of our municipal efforts around non-fatal overdose follow-ups. I know we've been working for several months to get everything in place that needs to occur to have all the data necessary to be able to go out and safely make contact with individuals who experience non-fatal overdoses in partnership with our community organizations. So Justin, turn things over to you to see how conversations are going between the Department of Public Health and the police department getting that data. And then we can see if there are any further questions where the conversation leads us. So Justin, the floor is yours. And as you state that, we are also being joined now by, I believe, Councilor Tim Allen is also joining us. So we appreciate Councilor Allen being here. And of course, also he was on the Public Health Committee for many years. So always takes a strong interest in these issues. Justin, the floor is yours.
Sure. I can just wait for Tim to get connected to audio for a second.
Looks like he is in the process of joining.
Yeah, I'll just wait till he's connected to audio.
I think he's in.
All right, sounds good. All right, so good news to report. So after our meeting in early March, since then, Sergeant Elliott and I met a few times, discussed the database that we have here at the health department that could be used to facilitate post-overdose outreach. And through the discussions that we had, we eventually brought Commissioner Clapprood and Commissioner Colton Harris together. We discussed it, and it was decided that the departments would like to move forward with data sharing. What we have to do now is we've reached out to the law department, and believe we're working with, hold on, Robert Shuchuk. I hope I'm saying his name right. Yeah. And he's going to be working with us when Brian comes back from Sergeant Elliott comes back from vacation. We're going to meet on the 13th with the law department and start working out this. I don't know how long that process will take, but just working out the nuts and bolts of the data sharing agreement. The software developers for us that are building the database need to, meet with the IT from the police department and just figure out how to connect with a direct API connection. So that needs to be worked out. But all positive movement. Once we are able to secure the connection, get the data over to the health department, what we're able to do with that, through the working with the police department, is able to use that to facilitate, teams like Gabe and Patrick, Patrick from Mercy Medical Center, to be able to go out and follow up with people. We're Sergeant Elliott and I were discussing utilizing sort of a quasi hub and core type format for this. So we still need to work out those pieces, but like I said, a lot of positive movement towards figuring this out. And that's basically where we're at right now. We're in the process.
Great. So I agree, Justin. That sounds positive. Definitely moving forward from where we may have been before. I guess my question would be, how far away are we from launching regular outreach? Certainly, I know Tapestry and others are doing sort of the broader outreach. But how far away are we from the model that, we've been discussing in terms of being able to get out to folks in a reasonable amount of time, on a regular basis?
As far as functionality, our database was ready to receive the information and would be ready to facilitate the outreach. I don't know how, this being my first time, involved with the law department trying to do a data sharing, I don't know how long that process is going to take. I'll have a better idea after we meet with them on the 13th. Then it's as far as building the API connection, the folk from the developers have told me that shouldn't be an issue. All they need to know is what data they'd be consuming from the police department and in what way that it's put together on their end, so they can build the connection to receive it correctly. So it's more or less just just figuring out the law department piece, and then it won't take long to train folk on the harm reduction side how to use the system. Basically, what will happen, we'll get the data, and when someone does overdose, it creates a sort of a case that will be attached to a team that will get a notification, and they'll be able to come in, access that information. What we have to work out is, how the police are going to, work with them on that. Because some of the stuff, Sergeant Elliott was saying that perhaps the police wouldn't have to be present. Some they would, and that's why we want to have that hub and core model. So we have the still type of stuff that we have to work out with how that's decided. But as far as the timeline, I would love to give one, but I don't know. I'm hoping within a matter of months, but I think it probably would be months at least before we're able to actually do it, because of my be discussing about how long it takes to come to the data sharing agreement piece, and then figure out the mechanics of how we're actually going to assign cases. But
yeah. What I'd like to see is I'd like to see the and I'm certainly cognizant of the fact that, especially with the health department, with such a focus on COVID response, and within the police department, the sort of shortages that we've seen in labor shortage that we've seen with individuals being out with COVID or with being deployed. We have a lot of folks that are National Guard Reserve that went out on deployment through the police department. So I'm sensitive to those challenges. But I'd like to see us expedite the timeline a little bit. So what I'm going to do is reach out to the law department, and I'm going to ask them to have that data sharing agreement done within a month's time. And I'm going to schedule a meeting 4 weeks from today with the law department and the police department and Department of Public Health for an update on that data sharing agreement. So hopefully we can see that move along fairly quickly, because I think it sounds like we're over the biggest hurdle, which was can we legally kind of do it? Sounds like we can. So I really appreciate the update, Justin, and all of your work and Sergeant Elliott's work with the commissioners to get us here. I know it was not it wasn't an easy task, especially working all this out, sort of uncharted waters. So great work in that regard. And hopefully we can help from the legislative end and just kind of moving some of the minutia of government, which, the wheels turn too slowly too often. But I think in this case, we all know, we just are out of time. We're just out of time. So with that, are there any additional questions for Justin? I see Councilor Curran with his hand up. Councilor Curran, go ahead.
Councilor Liederman, Councilor Allen, Councilor Gomez, Justin, and Ms. Maldonado, good evening. I just have a question there, Justin. Where are we in Springfield in terms of overdoses and overdose deaths, in terms of numbers from like 2015, 16, 17? I mean, if you have them, like, are we trending upward, trending downward, plateauing? Where exactly are we?
So we are.
Exact
So we are in the midst of a crisis, and Nellie can bolster with that. I don't have the numbers on hand right now since 2015, 2017. There was a spike you know, 2016 was a really bad year for the state in general, and since then numbers have not gone. It's sort of a plateau since then. But with Springfield, 2018, we went. I think it was 200% increase in overdose deaths. I'm flying off the cuff here with it, but it's but that I know for sure. That sounds about right, Nelly. Right? It's about 200%, and that prompted us, Tapestry, Health Department, and a bunch of other harm reduction, agencies to form the Greater Springfield Opioid Crisis Collaborative, which is what's fueled a lot of this work, including this initiative here to try to to build a database that could do this outreach at the Health Department, and to get the police to start sharing data, because our overdoses have been going up, and the data coming back from the pandemic, we've had a lot of increases in the minority population too as well, overdoses, Springfield's been hit harder than with that. In that last period, what I talked about, the state went down by like 1% when Springfield went up above 200% with their overdose deaths. So we're being particularly hit hard. The same was similar for Holyoke and Chicopee as well too. So our region was hit particularly hard by increases in overdose deaths, and that's been something that's really brought extra focus and attention to it.
Do we have, Justin, like a number like per year, let's say 20 of overdose deaths? Where are we at in Springfield?
We do. I can get those numbers, and I don't have them on hand right now, but I can get those numbers and send them over to you. We do have, and it's on the mass.gov for the DPH webpage for Springfield. Every year now, we're up to throughout 2020. We have the 2020 numbers of the 2019 numbers, so we know where we're at. We're over those deaths in the city of Springfield for the past year. Now that we're in 2021.
Would you have any kind of rough, what's the give an indication? Are we 100, or I mean, how or less than? I mean, where exactly are we?
I'd have to
114 in 2020.
Yeah, I have to pull those up.
114.
Correct.
Okay.
Those are in the city or town. It's 114 individuals who overdosed within the city of Springfield.
Gotcha.
Fatal overdoses. So not all of those are necessarily Springfield residents. However, the residential number is also high. The residential number is 86 in 2020. So it is. And
I apologize, Jesse. I don't know. Do you around 16? And I would agree with Justin. That's probably one of, I think, the height of the epidemic. What were they back then? Would you know? What if they're 100 now? What were they? Were they 200 then? I'm not sure. I don't know the number myself. But.
It was actually 75 in 2016.
Okay.
It's actually gone steadily up. It was 65 and 15, 75 and 16, went down to 56 and 17. And then 2018, which is when we started this conversation, that's when it went up to 108. Then it went to 103 and then 114 in 2020. So it's actually, while it has decreased in other areas, it has increased in the city of Springfield. And that's what sort of started this direct initiative conversation back in 2018.
And I'm guessing that's because of fentanyl is now more prevalent in the overdose deaths, I imagine. Is that what it is?
I would argue fentanyl is the heroin market right now. There really isn't heroin out there on it. It's fentanyl, and even in where there is heroin present, it is fentanyl is mixed into it. There is no heroin supply, opioid use without fentanyl involved in it now. So that's been a real problem. And I'm looking, and I just pulled it up. So 2020, Springfield had 86 opioid overdose deaths, and that was this past year.
Thank you.
And that went up from 2019, which was 72. So, and to give you context, in 2016 there were 40. So the increases in Springfield has been significant. You had 43 in 2015, 40 in 2016. Now we're double that, and we're plateaued where it's like 80, 70, and then 86. So it would definitely increase, and it's maintaining.
Thank you, Councilor Kern. Thank you, Justin. Councilor Gomez, Councilor Allen, did you want to follow up with anything for Justin?
No, I appreciate, can you hear me?
Yes, sir.
Okay. No, I appreciate you being on with us and working on this with us. I'm not happy to hear the numbers that you and Councilor Kern were pursuing, but obviously it means, shows how important this is. So, yeah, maybe has Commissioner Helen Calton Harris been invited to this, or is she someone you're going to invite in the future? Or?
Yes, Justin's representing Commissioner Calton Harris tonight, but she was on the initial conversation. So her and Commissioner Clapprood have been working on the high level piece, and then Justin and Sergeant Elliott have been doing the sort of details.
Okay, and how does this map with that Western Mass Addiction Task Force that meets regularly, monthly?
Is that the Hampden County Addiction Task Force?
Yeah, it meets like around the 8th of the month or something, or 10th of the month.
Yeah, so we do I go to those meetings, and I know Nellie does as well too. We do interact with them, it's through the Sheriff's Department and the District Attorney. And one of the reasons why we have the GSOC, the Greater Springfield Opioid Crisis Collaborative, is because we really, especially with those numbers, those increases over the, that happened, that we should really focus as a group on Springfield specific, the issue here. And that's why Nellie and I, work on that together as well. But we do try to collaborate with the county as well. That's it. Magda Cologne from the District Attorney's Office comes to our GSOC meetings. We have folk from the Sheriff's Department that come to our GSOC meetings as well too. So there's across the line collaboration there.
Okay, thank you. Thanks, Jesse.
Thank you, Councilor Allen. And to that same point, I know when I had spoken with another individual involved in the project, there was some talk of, once we have everything in place with the database, being able to refer out non-Springfield residents to their outreach that the Sheriff's Department is doing. That way we can focus inside the city. So, Councilor Gomez, did you have anything you'd like to add?
No, I have. Well, yes, there's one. How does numbers break rationally? What's the word I want to use? By communities, racial wise. That's the word I'm trying to get.
Yeah, we have some of those numbers as well too. It's still so it's there've been a large increases across the board in all ethnicities with regard to Springfield, but there are a large amount of Caucasian white affected by the but also we've seen where we've been seeing the most increases lately, though, have been in the Latino and African American community. Those are where the numbers have been. There were large numbers of white Caucasian overdose deaths, and a lot of what's also concerning is a lot of those increases with the Latino, Latinx, and African American communities are Springfield residents, and we've been seeing a lot of that. And of course, Nellie, coming from Tapestry, can speak to that as well too.
It's absolutely right. That's the increase that we've seen.
Thank you.
And it's across all a lot of different demographics, and also socioeconomic statuses as well too.
Thank you, Councilor Gomez. I think it's very important to highlight the communities that are especially being impacted the most by this. And again, these numbers are why I said at the beginning of the meeting, we're just out of time. So we need to expedite, and certainly we're glad to help in that regard. Nellie, before we bring the meeting to the close, did you want to add anything? We appreciate you being on and all the work you do at Tapestry and on the Health Council. So if you'd like to bring any additional contributions forward, we welcome you.
Sure. So, I mean, I have to, Justin has given a great, update on the work that we've done as, the GSOC and as well as the Hammond County Task Force. But as to Tapestry, we continue to get stories and get information from the participants that we are serving as to, what's going on out there. And Justin hit it on the nail where he said it's really fentanyl that's out there. And what we do is with this information that we collect is like we are out there on a daily basis, sometimes 2 outreach sessions a day, just going out to the community and just offering any information and supplies that we can. We have a mobile, number that people are calling us to meet them in different locations as well. So, when it comes to the outreach, if they're not coming to us, we're definitely going out into the different communities to provide the outreach that's necessary. Again, for supplies as well as giving them any education around overdose prevention. We continue, we have just started up again doing the Narcan presentations out in the community for loved ones and family members, just to make everyone aware of Narcan and to be able to train individuals to be able to use it to save a loved one or a friend.
Thank you very much, Nellie. Is there any other issues to be brought forward today on this by anybody on the meeting? Seeing none, I appreciate you all joining. Justin, again, for all the work you and Sergeant Ellie and the commissioners have done. I know in the midst, again, of COVID and in the midst of the especially shortage of manpower and womanpower that the pandemic has brought, being able to bring us from where we were, which was sort of a less certain place, to now is impressive. So what I will do is, go ahead, Justin.
I just wanted to say one thing that and I can, of course, share a lot of the statewide data and whatnot that we have if they want to move forward. But one of the key issues about this collaboration with the police department is the data is really slow to catching up with. We find about what happened in 2020, middle of 2021. We find out about a lot. All that data comes with quite a lag. With that police data, this is where the law department comes in, and we have to figure out the share. So the health department is able to see a lot of data for the public health needs that we have to do, and I can use this police data to get aggregate data, de-identified data, and we be able to know by zip code, by neighborhood, by ethnicity, age, all types of things. That's going to be really useful for us for statistics. But also we're able to do that post overdose follow-up. But one thing, Springfield desperately does need is to know what's going on with their population before halfway through the next calendar year. So this will be having this data from the police. Aside from being able to do this post overdose outreach, is really going to be great for us. We're just going to be able to know what's going on in the city public health wise by being able to take that data from the police department and use this database to show us what is going on with our population. And it will be able to be broken down by resident, non-resident, all the the data that you guys had wanted. That data will have that robustity and have it real, as much closer to real time than we currently have. So,
Mr. Chair, I have another question or a comment.
Yes, Counselor.
How can we track veterans? I think this population is very important and unique because we work with federal and with the veterans, and we need to know how many of our people, our veterans, are are dying out there because they have not been treated where they needed to be treated at the VA level.
I'm 99.9% sure that this is the question that we do ask. We have what we call an encounter and assessment form, and it is a question that we've been asking to be able to collect that information. So Mr. Gomez, what I can do is I can definitely check with our data entry person and see if I can collect that information for you and be able to share it.
I'm going to need that data as the state president for Vietnam Veterans of America and national chair with VVA. That information for us at that level will be superb for us to bring it to the Department of Veterans at the VA at VA level, so they will have an understanding what's happening in our areas, in our state.
How far would you like me to go back? To what year?
How far can you go back?
Again, I'm not the data person, so
I'd say 2 years if you could. You know, not to put too much restraint on you. 2 years will be fine. Especially, I want to cover that pandemic period because we want to know what happened to our veterans when the VA closed down on them.
Okay, I will look into that.
Thank you, Nellie.
Would you mind in the chat or giving me your email address so that I have it?
Yes, ma'am. It's SGT Sergeant SGT Gomez at AOL.com.
Oh, you're AOL too. Me too.
Hey, I'm a old dinosaur.
If it works, why change it, right?
All right, everybody. Well, thank you so much. As I mentioned, I will follow up with the law department, Justin, and let them know that this is a priority for the committee. And I'm going to schedule a follow-up meeting with the law department and everybody interested on August 4th at 5:00 p.m., which is 4 weeks from today. So hopefully we can get the data sharing agreement, the majority of it worked through by that time. And then we can see what other logistical pieces are in the way at that point.
And Consular Letterman, I just want to say thank you so much for, since the first time we met, you did say you were going to support us through this, and you've done that. And a lot of the work that's being done is because of your support as well. So thank you so much for that. It's greatly appreciated.
Amen.
Thank you, Nellie. Again, I apologize. The wheels of government turn too slowly, but we're gonna keep going, and we have great folks like Justin and yourself. And if I had to pick somebody, two guys to get it done, it's Justin and Sergeant Elliott. So I believe in them, and I'm sure we will see this come to fruition soon. All right, everybody, we'll adjourn the meeting for today. Please enjoy the rest of your evening and stay dry. It looks like.
Have a good evening.
Bye-bye.
Thank you.